Assalamualaikum and good day everyone. I hope everyone is doing well and having a good day so far. Today, me and Sittie, Ainah and Baraiman are going to present about Module 5, Understanding the Role of Leadership and Critical Thinking Principles to Improve Patient Outcome. At the end of this lecture, students will be able to identify and discuss the essential principles for successful teams and relate this with their own respective organizations. Discuss the concept and principles of transformational leadership and appreciate its relevance in the improvement of patient outcomes. These two topics are going to be presented by me. After I discuss about these parts, Ms. Baraiman will present the following, which students will be able to identify the different quality and safety issues in healthcare and come up with appropriate recommendations based on literature. Identify and discuss the role of advanced practitioners in promoting quality and safe patient care. Can I ask you something? When you're taking care of patients, have you ever wondered why some days everything seems organized and smooth, but other days, kahit we follow all procedures, the nursing procedures, there is a confusion or delay? I've noticed this too while observing the general nursing ward. It made me realize na hindi lang yung individual skills yung kailangan sa nursing. To better understand how teamwork and transformational leadership impact patient care, I will discuss findings from 9 journal articles. These studies will provide practical examples and evidence that we can relate to our own healthcare experiences. A long time ago, one doctor or one nurse could handle almost everything for a patient. People trusted them because they were always available and easy to approach. But times have changed. Healthcare today is nothing like it was decades ago. It is far more advanced but also much more complex. Every year, thousands of new studies and updated guidelines are published for doctors, nurses, and other professionals to follow. The sheer amount of information is overwhelming and it is impossible for one person to handle everything on their own. This is why teamwork has become essential. Different professionals bring their own expertise, share the workload, and make sure patients still get the best and safest care possible. This module will guide us in understanding the values, principles, and the strategies behind successful teamwork, while also learning how to overcome the common challenges that team members face. The definitions and their importance. When people hear healthcare team, they often picture a group made up of doctors, nurses, pharmacists, and other professionals working together. That is true, but the team can also be made up of people from the same profession who join forces for a shared purpose. A team is simply a small group of 2 or more people who interact closely, depend on one another, and adapt as they work toward a common goal. Each member has a specific role, and their time together as a team may last only for a limited period. Team-based healthcare is a health service delivered by at least 2 health providers, working hand in hand with patients and families to achieve shared goals across different settings. The heart of team-based care is collaboration, accountability, and patient-centeredness. Why this is important? Distributing tasks and accountability in healthcare can improve results. But when collaboration is lacking, patient safety may be compromised. One of the biggest reasons patients raise concerns or take legal action is because doctors, nurses, and patients do not fully understand each other. When a message is unclear or a details are missed, mistakes can happen. Sometimes mere accidents, sometimes wasted time, effort, or resources. An effective team is not just about dividing tasks. It's about members, together with patients, communicating openly, pooling knowledge, making decisions collectively for the patient's benefit. Recognizing how the work environment shapes team interactions and performance helps a person contribute effectively as a team member. Development and characteristics of a successful healthcare team. In healthcare, different kinds of teams exist depending on their purpose and function. 1. Core teams. These are the frontliners who provide direct patient care. They often include doctors, nurses, pharmacists, dentists, assistants, and case managers. 2. Coordinating teams. They handle the overall flow, making sure resources, schedule, and operations support the core team. 3. Contingency teams. Temporary groups formed during emergencies like code blue or cardiac arrest teams or disaster response units. 4. Ancillary teams. Support workers such as cleaners, technicians, or other staff who help create a safe and smooth environment for patients. Like any group, healthcare teams do not become they do not become effective instantly. They usually go through a series of stages. 1. Forming. At first, members are uncertain about their roles. Interactions can feel distant or formal because trust has not been built yet. 2. Storming. Conflicts or frustration may arise as individuals adjust to responsibilities and expectations. 3. Norming. Gradually, members learn how to communicate openly, agree on process, and work more smoothly together. 4. Performing. At this stage, the team operates at its best. Members trust one another, support each other, and focus fully on achieving shared goals. Once formed, healthcare teams function dynamically with one common purpose: to deliver safe and effective care to patients. To succeed, members generally share certain traits. They offer their expertise and skills even when working under pressure, know their responsibilities, and value the roles of others. Rely on one another since their tasks are closely linked. Decide and act together as a single unit. Challenges to effective teamwork. There are many challenges that make it hard for staff in healthcare to work well together and keep good teamwork going. 1. Shifting roles. In healthcare, responsibilities often overlap or change among professionals. When a role is unclear, it becomes difficult to assign tasks. 2. Changing environment. As patient needs evolve, especially with chronic conditions, teams must adjust or form new groups. These constant change can affect stability and coordination. 3. Strict hierarchies. Healthcare is traditionally structured with strong layers of authority. While this setup can bring order, it sometimes discourages open communication among members. 4. Individual-centered practice. Professions like nursing, dentistry, and medicine are historically built on one-on-one provider-patient relationships. This culture, while valuable, can sometimes clash with the idea of shared decision-making and teamwork. 5. Temporary teams. Some groups exist only for a short period, such as trauma units or emergency response teams. Their limited time together can make cohesion more difficult. 6. When teamwork breaks down. Major challenges often arise from the same root causes: vague division of tasks, inadequate coordination among members, or communication breakdowns. These lapses can result in missed deadlines, duplicated efforts, and diminished quality of work. 7. Handling conflicts. Conflicts can arise in any workplace, but finding healthy ways to resolve them is essential. This becomes particularly challenging in a busy general ward, in the hospital general ward, where a heavy workload or an emotional stress can make even a small misunderstanding feel overwhelming. A. Identify and discuss essential principles for successful teams and relate these with their own respective organizations. Principles of effective healthcare teamwork, based on Babigar and colleagues in 2014, Doherty and Crowley in 2013, Scott and Fold and colleagues in 2016. 1. Shared vision and common goals. All three studies emphasize that the foundation of effective teamwork is a shared purpose centered on patient welfare. Teams perform best when every member, doctor, nurse, pharmacist, or aide, works toward the same clinical and ethical goal. This shared direction prevents the fragmented or duplicated efforts and ensures that all actions align with what benefits the patients most. Diarrhea and colleagues in 2018, in the Philippine Health System Review, emphasized that local health units perform better when team members share a single mission, such as improving maternal and child health. Clear roles and mutual respect. Babigar and colleagues in 2014 and Doherty and Crowley in 2013 highlight that knowing one's professional boundaries and respecting others' expertise create order and efficiency. When tasks are clearly assigned and roles are understood, teams prevent confusion and conflict. Scott and Fold and colleagues in 2016 add that role clarity also builds mutual accountability, since each member knows what they are responsible for and who depends on them. Vagente and Dino in 2010 found that clear task delegation among Filipino nurses prevents medication and documentation error. Assigning specific duties, for example, one nurse handling vital signs while another manages records, keeps workflow smooth despite limited manpower. 3. Effective and open communication. Across all three studies, communication is consistently described as the lifeline of teamwork. Babigar and colleagues stress that structured, open dialogue prevents medical errors. Doherty and Crowley view communication as a professional duty that sustains trust and transparency. Scott and Fold and colleagues extend this by recommending systematic communication tools, such as handoff checklists and shared care plans, to keep all team members informed and coordinated. De la Cruz and Garlang in 2019 in the Philippine Journal of Nursing noted that communication tailored to cultural language improves trust between healthcare workers and patients. In BARM, using local terms such as in Maranao or Tausog or in Maguindanao or interpreters during health teaching helps patients feel respected and understood. 4. Trust and psychological safety. Doherty and Crowell in 2013 referred to a culture of trust, while Babiker and colleagues in 2014 explained that mutual respect builds confidence among team members. When healthcare workers feel safe to speak up, admit mistakes, and suggest improvements, the whole team becomes more reliable and adaptive. Psychological safety enables learning rather than blaming, which is essential for continuous improvement. Alonso and Adium 2020 reported in a BARM health governance survey that interfaith respect in hospitals, such as recognizing prayer times or fasting schedules, strengthens unity among diverse teams. When staff feel emotionally safe, they perform better and stay longer in service. 5. Flexible and adaptive leadership. Doherty and Crowell described this as dynamic roles, where leadership may shift based on who has the right skill for the situation. Scott and Fogg and colleagues reinforced that adaptive leadership allows teams to function effectively under changing patient needs or crisis conditions, ensuring that care remains uninterrupted. Dizon in 2018 highlighted that adaptive leadership is vital in resource-limited Philippine hospitals, where nurses often step up during emergencies. In BARM, flexible leadership is visible when a senior nurse leads triage during fraud or conflict evacuations, while doctors handle critical interventions. 6. Patient and family-centered approach. Scott and Food and colleagues in 2016 placed patient and family engagement at the heart of team-based care. They emphasized that patients are active members of the healthcare team, not passive recipients. Babiker and colleagues and Doherty and Crowley similarly stressed that all teamwork efforts must ultimately serve the patient's best interest. By listening to their concerns, respecting their preferences, and involving their families in care planning and decisions. Lagrada in 2008 found that involving Filipino families in decision-making enhances compliance and recovery. In BARM, healthcare teams that invite parents into immunization discussions or respect elders' input in care plans build stronger trust and cultural harmony. 7. Continuous learning and shared accountability. Babiker and colleagues point out that healthcare teams improve through continuous professional development and reflection on mistakes. Scott and colleagues discuss continuous quality improvement, which means regularly reviewing outcomes and learning from both success and failure. Doherty and Crowley also underscore accountability. Each team member must own their part of patient care, ensuring integrity and reliability across the team. Aligat and De La Cruz in 2020 observed that rural hospitals in Mindanao improved safety outcomes when teams conducted post-incident reflections and peer monitoring. In BARM hospitals, regular case reviews after emergencies foster humility, shared learning, and teamwork growth. 8. Supportive organizational environment. According to Doherty and Crowell in 2013, teamwork thrives when institutions provide the right environment, adequate staffing, fair workload, training opportunities, and leadership support. Babiker and colleagues in 2014 agree that teamwork cannot exist without organizational backing that values collaboration over hierarchy. Similarly, Scott and colleagues in 2016 mentioned that supportive infrastructure like management, policies, and systems create stability and allows teamwork to flourish. Madriaga in 2018 noted that Filipino nursing leaders who practice empathy and inclusion create more unified and motivated teams. In BARM, supportive leaders who consider staff fatigue, prayer breaks, and local sensitivities inspire loyalty and improve service quality. 9. Efficient coordination and use of resources. Scott and Phil and colleagues emphasize coordination through technology and systems that connect care across settings. Babiker and colleagues recommend resource awareness and organization, knowing what tools are available and how to use them efficiently. Effective teamwork ensures that time, supplies, and skills are used wisely, preventing patient delay and system overload. Labarda in 2019, identified that structured nurse-to-nurse handoff and clear referral forms reduce miscommunication in rural Philippine settings. In BARM hospitals, simple checklists or inventory boards help maximize scarce medicines and ensure continuous patient care. 10. Commitment to improvement and innovation. Finally, all three works agree that teamwork is a continuing process of growth. Baker and colleagues frame it as learning from mistakes. Hurt and Crowley describe it as professionalism in practice. Scott and colleagues encourage ongoing evaluation and innovation. This principle reminds teams to adapt, update their practices, and continuously aim for better patient outcomes through collaboration. Romualdez and colleagues in 2011 pointed out that continuous learning and adaptation strengthen local health systems in the Philippines. Barm hospitals introduced digital records or community-based reporting systems during COVID-19 proved how innovation and teamwork can save lives. Summary insight. When combined, the findings of Baker and colleagues in 2014, Hurt and Crowley in 2013, and Scott and colleagues in 2016 reveal that effective healthcare teamwork is built on shared goals, clear roles, open communication, trust, adaptability, patient-centeredness, accountability, and institutional support. These are not separate ideals, but interconnected behaviors that together make healthcare delivery safer, more efficient, and more compassionate. Here is how it would look like in a case scenario I would like to share. A case scenario on fighting COVID-19 together. At the hospital in Cotabato City, Mariam, a 45-year-old teacher with severe COVID-19, was rushed to the ICU gasping for air. The healthcare team, doctor, nurse, respiratory therapist, pharmacist, and nutritionist, worked urgently to stabilize her as the ward grew busier with new patients. The doctor led the plan of care, while the nurses and the respiratory therapist worked tirelessly to keep her oxygen level stable through long, tense hours. The pharmacist double-checked medicine supplies amid shortages, and the nutritionist adjusted her feeding plan as her condition changed. Despite fatigue and fear, the team communicated constantly and respected one another's roles to keep Mariam safe. When her oxygen dropped suddenly one night, their quick coordination and calm teamwork prevented Mariam from going into respiratory failure. After 2 long weeks, Mariam slowly recovered and thanked the team for treating her with compassion and patience. In their debriefing, they reflected on the struggles and lessons learned, showing Baker and colleagues' teamwork, Hurt and Crowley's shared learning, and Scott and colleagues' patient-centered care in action. B. Discuss the principles of transformational leadership and appreciate its relevance in the improvement of patient outcomes. The authors share the same core foundation. They're all anchored on transformational leadership theory, but each author emphasizes different facets of it, depending on their research context. Hospital versus home care, Finland versus Taiwan. The principles of transformational leadership and their relevance to patient outcomes. 1. Empowerment and shared influence. Asif and colleagues in 2019, Poama in 2017, and Mantin and colleagues in 2014 agreed that transformational leaders empower nurses by giving them influence and control over their work environment. When nurses are trusted to make clinical decisions, they feel valued and capable. This empowerment reduces error, builds confidence, and enhances patient safety. Nurse leaders who delegate decisions, like allowing staff to adjust nursing care plans within safe limits, can improve teamwork and speed of care, especially in municipal hospitals. 2. Job satisfaction and motivation as pathway to quality. Asif and colleagues in 2019 and Lin and colleagues in 2015 showed that satisfied nurses are more motivated and emotionally resilient, which leads to fewer adverse outcomes and more consistent quality care. Motivated nurses help maintain morale, often stay longer, care better, and advocate for patients more strongly amid limited staffing. 3. Supportive and safe work environments. According to Asif and colleagues in 2019, Ree and Wig in 2020, and Boama in 2017, transformational leaders actively reduce barriers to safe care. They redesign workflow, listen to staff needs, and promote environments where nurses can speak up about safety issues without fear. Supportive leaders who protect staff and focus on system fixes, like reorganizing emergency supplies, cultivate a culture of safety and continuous improvement. 4. Participatory and team-based decision-making. Rhee and Wig in 2020 and Thomas in 2016 emphasized that transformational leaders invite everyone's voice, junior nurses, midwives, and nurse aides as well, in planning and safety discussions. Shared decision-making makes staff more engaged and committed to outcomes. 5. Leadership development and character formation. Thomas in 2016 and Mantinan and colleagues in 2014 highlight that leadership is learned. Training programs that teach empathy, moral character, and transformational behaviors strengthen leaders who inspire others through integrity. Leadership training that blends Islamic values such as sincerity, justice, and compassion with nursing leadership frameworks can shape leaders who serve both ethically and effectively. 6. Communication, trust, and respect. Lynn and colleagues in 2015 and Rhee and Wig in 2020 found that open communication builds trust and engagement, which are vital for teamwork and patient safety. Transformational leaders encourage dialogue, they provide emotional support and listen deeply. In multicultural BARM hospitals, where staff may speak Magindanaon or Tausog or Maranao, leaders who respect language and culture bridge communication gaps, reduce misunderstandings, and strengthen trust across faith and ethnicities. 7. Structural empowerment and shared accountability. Asif and colleagues in 2019 and Boam in 2017 describe how structural empowerment, providing resources, authority, and access to information, enables nurses to act responsibly and confidently. This shared accountability ensures that quality care becomes a team mission. Giving nurses authority to monitor infection control or report safety lapses directly helps improve outcome and build ownership among staff. 8. Work engagement and well-being. Rhee and Wig in 2020 and Lynn and colleagues in 2015 underlined that engagement grows when leaders care for mental health and balance workloads. Leaders who notice fatigue and promote rest help nurses stay attentive and compassionate. In BARM hospitals, leaders schedule prayer breaks and rotation plans for staff nurses to support both physical and spiritual well-being, sustaining safe and mindful care. 9. Continuous leadership development and learning culture. Mantinan and colleagues in 2014 found that even if leadership scores stay consistent, long-term investment in leadership development improves satisfaction and patient safety over time. Transformation is gradual but lasting. In BARM, ongoing seminars, mentorship, and local nurse research groups, such as nursing research councils, can build steady progress in leadership and quality care. 10. Linking leadership to patient outcomes and satisfaction. Across all studies, the clear message is that transformational leadership is not abstract. It directly affects how patients feel, and trust the system. As nurses feel empowered, satisfied, and safe, patients experience safer care, fewer errors, and more quality service. Leaders who inspire through compassion and collaboration transform hospitals from just places of treatment into communities of healing. Summary insight. Each author's view on transformational leadership from a different angle on empowerment, satisfaction, engagement, or education all converge on one truth. When the leaders lift out others, patient care rises with them. In the Islamic context, this leadership style reflects the values of rahmah, compassion, amana, trust and responsibility, and ukhuwah, brotherhood and sisterhood in faith. When healthcare leaders embody these virtues, their work transcends routine management. It becomes an act of worship. Here is how it would look like in a case scenario I would like to share and I would like to highlight as well. At the district hospital Maguindanao del Sur, in Maguindanao del Sur, nurse supervisor Maisona led her medical ward team during a sudden leptospirosis outbreak that followed weeks of heavy flooding. Many patients arrived with high fever, body pain, and jaundice, while others were anxious about their worsening symptoms. Despite the pressure, nurse supervisor Maisona maintained her calm, reassuring presence, guiding her team with clarity and compassion. Following the insights of Asif and colleagues in 2019, nurse supervisor Maisona emphasized structural empowerment by allowing her nurses to recommend efficient care routines. such as organizing a hydration and antibiotic tracking chart for each patient. This improved coordination, minimized medication delays, and boosted the overall quality of care. Applying Re and Wood in 2020, she fostered a patient safety culture by encouraging open communication during shift endorsements. When a nurse identified the risk of cross-contamination between high-risk and recovering patients, Nurse Supervisor Maisona commended the observation and promptly adjusted the isolation procedures, reinforcing a culture of learning. In line with Thomas in 2016, Nurse Supervisor Maisona practiced appreciation and empathy. She personally thanked her nurses after every shift, reinforcing job satisfaction and team spirit even under pressure. Inspired by Baraiman in 2017, Nurse Supervisor Maisona prioritized nurse well-being by arranging proper hydration breaks and creating a small rest area for the team during long shifts. She also respected diverse faith practices, giving space for reflection and prayer, helping staff restore focus and emotional balance. Reflecting Lean and Felix in 2015, Nurse Supervisor Maisona nurtured organizational commitment by connecting the team's work to a deeper purpose. She often reminded the team, every patient we save is a father, a mother, or a child who can return home. This sense of belonging and shared mission kept the staff united, reinforcing their pride as frontliners serving their own Bangsamoro community. Finally, consistent with Mantina and colleagues in 2014, Maisona promoted patient safety and quality improvement through team-based mentoring. Experienced nurses from Cotabato and Maguindanao guided newly hired staff in aseptic wound care, IV infusion techniques, and emergency response for leptospirosis complications, and ensuring that every patient received the right treatment at the right time. In the following weeks, the leptospirosis ward, once felt overwhelmed and uneasy, became more organized and resilient, proving that transformational leadership grounded in compassion, respect, and teamwork can truly elevate patient care in the bottom setting. These would be my topics on learning outcome A and B, and I would like to proceed this with to Miss Sittie, Ainah, and Baraiman. Thank you so much for listening.
Assalamualaikum and good morning everyone. I am Sittie Ainah Baraiman, and let us move on to the third subject of the topic assigned to us, and that is quality and safety issues in healthcare. First and foremost, let me define quality by the definition of the Institute of Medicine. Quality is the degree to which health services for individuals and populations increase the likelihood of desired health outcomes, meaning it refers to how well our health services are delivered, which increases the chance of achieving the intended health outcomes. Ano-ano yung mga intended health outcomes natin? Cure, symptom relief, disease prevention, or improved quality of life, and are consistent with current professional knowledge. Ibig sabihin, to be considered high quality, these services must also be evidence-based. So, hindi lang effective but also evidence-based, meaning ano siya, up-to-date. So, an example of this is positioning the newborn baby upside down and spanking to make the baby cry, which is yan yung dating practice. Pero ngayon, hindi na siya gina-practice kasi na-found out na hindi siya safe sa baby. So, instead, the baby is gently placed on the mother's womb and lightly massage para mag-cry siya. So, in short, quality captures both effectiveness, meaning producing the desired health outcome, and appropriateness, using the right up-to-date methods. So, yung quality, pag nagbigay ka ng, paano malalaman na nakabigay ka, nakaprovide ka ng quality care? It is effective and at the same time, it is appropriate. Then, patient safety, as defined by the World Health Organization, is the absence of preventable harm to a patient during the process of healthcare. So, what are the examples of preventable harm? These are, for one, is fall injury. May iwasan ng fall injury by raising the bedside rails all the time, especially if your patient is a child or an elderly or he or she is disoriented. Another example is bed sore. May iwasan ito by turning the bedridden patient side to side Q2 and ensuring that the pressure points are clean and dry. Also, chronic diseases in the community are caused by smoking and poor diet, which can be prevented by educating them through health teaching. So ano pa? progression of diseases to more serious stages by not getting recommended screenings or unavailable vaccinations. Okay, so one of the key indicators of quality healthcare relies on safety. So this is the umbrella of healthcare where patient safety is under. Quality care daw is safe, effective, na-achieve ang desired health outcome natin. Patient-centered, you respect patient's preferences, kung ano yung values niya and needs. Timely, yung interventions na ginabigay natin is napaprovide natin siya without unnecessary delay. And efficient, there is enough manpower, kompleto ang medications, vaccines, and supplies, at well-functioning ang mga gamit or equipment. And lastly, equitable. All individuals receive the same high-quality care. Thus, safety is the foundation upon which all other aspects of quality care are built. Many patient safety practices, such as the use of simulators, like high-fidelity simulators to let clinicians rehearse procedures, barcoding, computerized physician order entry, like utilizing electronic health record or EHR, and HIS, Health Information System, and crew resource management. Ang crew resource management is tinatrain ang mga healthcare workers in non-technical skills such as communication, leadership, decision-making, situational awareness, and workload management. So these have been considered as possible strategies to avoid patient safety errors and improve healthcare processes. The origins of the patient safety problem are classified in terms of these four. First is type. Ano yung type of error? Medication error ba or IV error? Communication, like miscommunication between patient or patient proxy and practitioners, practitioner and non-medical staff, or among practitioners. Patient management, like meron bang improper delegation, nag-delegate ka ng meds sa junior staff nurse without giving proper instruction na she will only give, this is an example only, she will only give nimodipine if the BP of the patient is within normal range. So if not, do not give nimodipine. So, failure in tracking, like following up a patient's lab results. Example, mababa pala ang albumin level ng patient at kailangan ma-start ang serum albumin Q8 niya stat. Kaso, di mo finalo up kaya na delay ang treatment at naging complicated ang condition ng patient. And wrong referral, sa physician na hindi niya specialty ang condition ng patient is doon mo pa siya na-refer. And lastly is clinical performance. Ano yung mga need mong i-assess before giving the intervention? Ano yung mga need mong gawin during the pagbigay ng intervention? And ano yung mga need mong bantayan after giving an intervention? The root causes of harm are identified in the following terms. First is active failures. These are direct human actions or omissions by those closest to the patient that led to errors or harm. They are sometimes called errors at the sharp end. Examples of active failures are a nurse administering the wrong medication and a surgeon performing an incorrect procedure on a patient. So, latent failures, these are pre-existing, less obvious flaws within the healthcare system's design, environment, or organization. They are often considered accidents waiting to happen. Examples are poorly maintained or malfunctioning medical devices like a mechanical ventilator and inadequate training of newly hired staff nurses, which is prone sila to errors. So, dapat is meron silang adequate training bago sila salang sa field. And then, organizational system failures. These are indirect failures involving management, organizational culture, protocols or processes, transfer of knowledge, and external factors. And examples are ineffective management and poor leadership. So, meaning yung mga boss nyo is hindi sila effective or na management and leader. Pwede din yung head nurse nyo or yung or supervisor, and resource constraints or kakulangan ng staff, equipment, and supplies. And lastly, technical failures. It refers to the malfunction or breakdown of a medical device, system, or equipment that prevents it from working as intended. And examples are yung kanina sa latent na malfunctioning devices, software, and cybersecurity failures. So, lalo na yung mga nag-utilize ng EHR and HIS. The following risks were relatively high in the healthcare sector. First is biological risks such as bloodborne pathogens, airborne pathogens, and contact diseases. Examples are needle prick with patient na HIV positive, and not wearing proper PPE when entering isolation room. Secondly, chemical risk such as exposure to chemicals. Ano yung mga chemicals na to? Allergenic substances or carcinogens used in healthcare settings. Examples are preparing anti-neoplastic or anti-cancer drugs for patient who undergoes chemotherapy, and the use of formaldehyde as a cleaning and disinfecting agent, which can cause nausea and irritation of the eyes. Physical risks such as exposure to X-rays. We all know that the X-ray radiation can cause fertility problems to women and birth defects to pregnant women. Safety risks such as noise, radiation, sleeps, trips, and falls. So, ang noise nakakakos naman talaga yan ng safety risk kasi it increases stress, fatigue, and causes sleep disturbances. And then ergonomic risks such as lifting, pushing, awkward positions, repeated movements, and prolonged standing and sitting. An example of this is yung head nurse namin sa ICU. 8 years na siyang ICU nurse, and sa loob ng 8 years na yon is patient lifting siya and turning the patient. So, Q2 yan sa ICU. So, ang nangyari, ang result is nagka-scoliosis siya. So, ngayon is until now, nung nandun pa ako, and then until now, nag-physical therapy siya. And then, psychosocial risk, such as long working hours, time pressure, emotional demands, stress, and burnout-related factors, and bullying. Sa bullying is most common yan sa mga senior nurses na ginabully nila ang mga newly hired nurses or mga junior staff nurses. These are the common safety issues in healthcare. So, fall injuries. Fall injuries, especially in pediatric and geriatric patients, wound and pressure ulcer. Ang prone dyan is mga bedridden and intubated patient. Pneumonia, lalo na ang mga stroke patients and those who have chronic illnesses. Medication and IV errors. Ito is usually due to a physician's illegible writing. Kaya, gina-encourage ang paggamit ng EHR. And then, adverse drug events. Example, serum albumin Q8 could lead to congestion. And peptides can affect the creatinine level of a patient. Urinary tract infections, most common in patients who have an indwelling catheter. Nosocomial infections or what is called hospitalized acquired infections, especially sa mga patients na long staying in the hospital. And then work stress and burnout. Ito naman is sa mga healthcare workers. So these are the 4 critical behaviors that are under our control that help to improve patient safety. So they were classified as following safety protocols such as proper disposal of sharps, and following the designated waste or garbage disposal. Speak up when you have concerns. So, wag kang matakot or mahiya when may concern ka, lalo na kung nakasalalay doon, is safety mo or safety ng patient. Communicate effectively always sa mga other nurses, other practitioners. Take care of yourself. So, ito, kahit sa BLS, is ang unang-unang tatandaan mo pag mayroong disaster is you survey the scene, and if it is not safe, don't risk yourself. Let us move on to the top 9 patient safety concerns in 2025. Number 1 is risks of dismissing patient, family, and caregiver concerns, or what is called the medical gaslighting. According to one survey conducted in 2023, more than 94% of respondents reported instances where they felt their symptoms were ignored or dismissed by a doctor. So what are the examples of medical gaslighting? So I'll give 3 examples. The number 1 is refusing to discuss symptoms or medication concerns, saying that the patient is exaggerating, and another is saying that there's nothing else we can do, or let's not worry about that now. So ano yung mga action recommendation, or ano yung action recommendation for this concern? So conduct open conversations with staff to highlight the impact of medical gaslighting behaviors and cognitive biases on diagnosis. So, number 2 concern is the insufficient governance of artificial intelligence in healthcare. So, AI naman to. A 2024 survey of over 2,300 registered nurses found that 60% disagreed with the statement, "I trust my employer will implement AI with patient safety as the priority." So this is a problem for organizations that do not have a system-wide governance policy for AI usage and data access, as it can increase healthcare organizations' liability risks. So, anong action recommendation for this? Train staff on the organization's AI usage policy, including which AI applications are approved and prohibited for job-related activities and whom to ask should confusion arise. And then number 3 is the wide availability and viral spread of medical misinformation, empowering patients through health literacy. So, yung misinformation is widely available and dispersed further and faster than before, with one study finding that false information is 70% more likely than the truth to be shared on social media. So ngayon is may, aside sa Twitter, meron ng Facebook and TikTok, and through these platforms, it will reach people 6 times faster. So this availability and rapid spread of medical misinformation may lead to patients requesting ineffective or dangerous treatments or cause patients to forgo mga proven effective treatment. An example of this is Facebook groups where members claim that feeding children chlorine dioxide, a disinfectant similar to bleach, will cure their autism. So if viral misinformation is the disease, health literacy is part of the cure. By improving health literacy, healthcare organizations help patients identify medical misinformation and take a more active and informed role in their healthcare decisions. So ano yung action recommendation dito? Conduct educational campaigns and workshops to inform the local community of common medical needs, strengthen critical thinking and media literacy, and stress the importance of seeking evidence-based information. So number 4 is medical error and delay in care resulting from cybersecurity breaches. In a survey of healthcare cybersecurity professionals, 88% reported that their organizations experienced cyber attacks in the past year with an average of 40 attacks per organization. So ang dami nun, 40 attacks per organization. Cybersecurity breaches can cause widespread disruptions and have broad and devastating effects that impact patients, providers, healthcare organizations, and the surrounding community. So, anong example nito? Patients can experience poor outcomes from delays in tests and procedures, longer lengths of stay, more complications from medical procedures, more transfers, and higher mortality rates. So they may also face exposed information, including personal health information. So, anong action recommendations? Include cyber attack response in the organization's emergency preparedness plan, and collaborate with local partners and healthcare organizations to ensure that there are established strategies for combating cyber attacks, and also monitor compliance with cybersecurity policies and procedures. Number 5 is the growing threat of substandard and falsified drugs. In 2021, 2 California oncologists pleaded guilty to purchasing more than $1 million of unapproved, substandard, and falsified cancer drugs that contained no active ingredients from an online pharmacy. Substandard and falsified drugs are frequently adulterated with potentially lethal ingredients including fentanyl. Other harmful substances found in the substandard and falsified drugs include rat poison, cement, and heavy metals such as arsenic and mercury. So even when not contaminated with dangerous material, counterfeit drugs often lack the active ingredients to be effective. So their use can impose a significant economic burden on patients and healthcare organizations due to costs associated with ineffective treatments and the management of prolonged illnesses. Substandard and falsified medications account for an estimated 10% of medications circulating in low and middle-income countries. This can have the largest impact on the most vulnerable communities. So, anong action recommendation? Include a scripted, open-ended question asking patients where they obtain their medications when reviewing a patient's medication history. Number 6 is diagnostic error, the big 3: cancers, major vascular events, and infections. Misdiagnosis of cancers composed of 37.8%, vascular events 22.8%, and infections composed of 13.5% account for the majority of high severity harm based on close malpractice claims. Diagnostic errors or misdiagnoses result from a wide array of system factors, from cognitive Errors and clinical assessments, example, inadequate knowledge and experience, lack of competency, poor critical thinking and clinical decision-making skills, problems in data gathering, failing to synthesize and communicate information, to breakdowns in the diagnostic process. Example, failure to order, collect, and process diagnostic and laboratory tests, inadequate medical history and physical examination, failure to manage referrals and follow up with the patient. Number 7 is persistence of healthcare-associated infections in long-term care facilities, or what is called the HI. So according to the Center for Disease Control and Prevention, or CDC, every day, 1 in 43 nursing home residents contracts an HI. So HI, or the healthcare-associated infections, are infections that a resident develops from complications of healthcare. Many HIs are caused by multi-drug resistant organisms and can cause severe illness, sepsis, or death. So highs in long-term care facilities are increasing. So that is why kasama siya sa patient safety concerns in 2025. Inadequate communication and coordination during discharge. One of the most common causes of medical errors is the communication failure, and a majority, 67% of these failures occur during handoffs, including discharge. So when poorly managed, care transitions can lead to adverse events, worsened physical conditions, increased emotional distress, poorer health outcomes, and increased healthcare costs. Engaging patients and families in the discharge planning process has been shown to result in reduced hospital readmissions because there are patients who are non-compliant. So dapat pag magbibigay ka ng instructions pag discharge na siya, is present ang family niya or yung asawa niya, anak niya, ganun. Kasi maraming mostly or may mga patients na non-compliant. And then number 9, deteriorating community pharmacy working conditions contribute to medication errors and compromise patient and staff safety. So almost 33% of pharmacy staff in 2021 were at a substantial risk for distress, which carries an 8-fold higher risk of burnout and 2-fold higher risk of medication error. So one respondent to the 2022 survey noted that high pressure, inadequate staffing, and customer abuse have led to the administration of incorrect vaccines and the dispensing of prescriptions to the wrong patient. The increased workload and poor working conditions contribute to pharmacy staff distress. Let us move on to the role of the advanced practice nurse in promoting quality and safe patient care. Advanced practice nurses, or APNs, are registered nurses who have acquired an expert knowledge base, complex decision-making skills, and clinical competencies for expanded practice and enter the workforce with a master's degree. They assess, diagnose, and treat patients, coordinate care across multidisciplinary teams, and lead quality improvement initiatives. APNs also serve as educators, patient advocates, and are at the forefront of evidence-based practice to improve the outcomes and ensure safety. Generally, in the ICU setting, the involvement of nurse practitioners in managing the critically ill allowed for greater continuity of care, as nurse practitioners did not have to be on frequent rotation coverage as junior physicians. Hence, nurse practitioners developed greater familiarity with the environment and patient demands than the physicians who were constantly on rotation. Number 1 is direct clinical practice. Under this is patient assessment and management, preventive and public health, and emergency care. In patient assessment and management, APNs assess patient health situations, order diagnostic tests, prescribe medications, and manage chronic diseases, and providing holistic and comprehensive care. In preventive and public health, they play a key role in delivering primary and preventive care, educating the public on health issues, and increasing access to care, particularly in underserved areas. Emergency care. APNs are crucial in emergency settings for triaging, managing patients, and coordinating care during crises. And then for the leadership and coordination. Team leadership. APNs guide multidisciplinary teams, make complex decisions autonomously, and act as a point of reference for both patients and other professionals. Care coordination. They coordinate patients' care process, ensuring a smooth and continuous pathway and helping to reduce safety gaps in the system. System improvement. APNs are instrumental in driving practice changes and implementing best practices and evidence-based to improve patient outcomes. And then advocacy and education. Policy advocacy. They advocate for policies that promote evidence-based practice, reduce health disparities, and encourage interdisciplinary collaboration. Patient and family education. APNs educate patients and their families about their health, treatment, and how to manage conditions, empowering them to be active participants in their care. And professional education. They educate and mentor other nursing staff, helping to elevate the overall quality of care within an organization. In the research naman, research contribution, they can actively participate in nursing research by conducting implementation and action research projects that contribute to the broader nursing research agenda, foster a culture of research. As leaders, APNs guide their multidisciplinary teams in understanding and implementing evidence-based practices. And then improve system-wide safety. APNs help create a culture of safety throughout the organization, which is built on the foundation of research and evidence. So, Yung Wo, Yuli, and Santam conducted a systematic review in 2017 that was published in a global journal with the title The Impact of the Advanced Practice Nursing Role on Quality of Care, Clinical Outcomes, Patient Satisfaction, and Cost in the Emergency and Critical Care Settings. So there is still a scarcity of doctors. So despite the fact that the demand for emergency and critical care services has grown, the purpose of this study was to assess how patient outcomes might be affected by giving advanced practice nurses more authority on emergency and critical care settings. So this review suggested that the implementation of advanced practice nursing roles in the emergency and critical care settings improves patient outcomes. Accordingly, nurses in the advanced practice can add value and increase access to healthcare by potentially strengthening the healthcare workforce. The involvement of APNs also provided the unit staff with a consistent point of contact for the multidisciplinary team. When daily multidisciplinary rounds were initiated by nurse practitioners, the coordination of care was shown to improve. And then lastly, the length of stay for patients was reduced with the help of APNs. In addition to providing effective care, advanced practice nurses get experience in managing particular patient groups through delegated tasks. Then when cross-disciplinary communication, discharge planning, follow-up, care, and administrative tasks were necessary for patient care, the benefit of APNs was demonstrated. So that's all. Thank you.